Tonight, a question of risk. In the Crossfire, Dr. Sanford Kubin of the National Foundation for Infectious Diseases. And in San Francisco, Ben Schatz of the American Association of Physicians for Human Rights.
Good evening. Welcome to Crossfire. According to a new CNN Gallup poll, 87% of Americans think that all doctors should be tested for AIDS. 84% think all nurses should be tested as well. But what is the actual chance of catching AIDS from your doctor? A decade into the epidemic, with 1 million Americans infected, including several thousand doctors, there isn't a single documented case of a doctor or nurse transmitting AIDS to a patient. There is one case of probable transmission by a dentist in Florida. Nevertheless, America's leading medical associations have begun to recommend restrictions on doctors who test positive for the AIDS virus. The Centers for Disease Control reported today that 3 people got AIDS and died after heart and kidney transplants from the body of an infected man. Reports like this keep the public alarmed and insisting on its right to know. Fred Barnes is rounding out his week in the Buchanan chair. Fred?
Mr. Schatz, I'm sure you know who Kimberly Bergalis is, the 23-year-old Florida woman who got AIDS from her dentist when he pulled a couple of her teeth. She is now... Some months ago, she was a woman of 120 pounds. She's now 65 pounds. She is very sick with AIDS. And I would like you to tell me how you would explain to her, not to me, not to civil rights lawyers, but explain to her why her dentist should not have been required to inform her that he had AIDS before he operated on her and pulled these teeth.
Well, I think that's a really good question, and I think it's a fair question. I feel really bad for Kimberly, just as I feel bad for everybody who has AIDS. And I think that what I would say to Kimberly is that I'm really sorry that she's sick, but that on net, if we test and restrict doctors, more people will become sick than if we don't. That unfortunately we don't live in a risk-free society, and if we throw out thousands of health workers from their jobs in a nation that already has a health worker shortage because of a completely remote risk, a lot more people are going to lose their lives than if we allow those people to continue practicing. Either way, there's some risk. Well, Mr. The question is, which risk is greater?
Mr. Schatz, you're talking about throwing out all these healthcare workers, doctors and nurses and so on. Why can't they go and treat AIDS patients? We have 1 million AIDS patients. Why can't they deal with them?
Well, I think that in many cases that's simply impractical. For example, I've spoken to a man who's the only OBGYN in his area. He's in a rural area. Now, there clearly are not enough women in that rural area for him to treat. And so therefore, you're basically telling him to leave his practice completely and to leave that area without any qualified OBGYN. Well, I'm sure the result would be that a lot more people would be harmed.
Dr. Kubin, 150,000 people at least die every year from botched medical care. Thousands die from hepatitis they've caught from their doctor. Hundreds die from botched anesthesiology. Why are you devoting so much energy to stirring alarm about a risk that is, at most, extremely small?
Well, first of all, nobody is stirring alarm. We're trying to educate the American people about an epidemic which is not contracting, it's expanding, as is hepatitis B. In fact, hepatitis B and HIV are the 2 leading viremias affecting the American public today. We have 1.5 million carriers of HIV, all of whom are loaded guns. We have about 1.5 million carriers of hepatitis B, a much more infectious disease. Hold on. We have today, 500,000 physicians, 160,000 dentists. That's a tremendous workforce doing a fantastic job. In that group, there are about 6,000 healthcare workers who are infected with AIDS and about 40,000 who are HIV carriers, all potential lethal weapons. And we have thousands more that are infected with hepatitis B.
Well, let me ask you about hepatitis B. There's clearly, I think you would concede, far, or even trumpet the fact that it's far more of a risk of catching a fatal case of hepatitis B from your doctor when you go in for surgery than catching AIDS.
wrong in the sense that it's not far of a fatal risk. It's far more of a risk because hepatitis B is 100 times more infectious than HIV.
And people do die from it.
They certainly do. In fact, on a global...
More than 1 out of 100.
On a global basis, there are 300 million carriers of hepatitis B. 60 million will die from primary liver cancer from hepatitis
Well, look,
B.
here's my point. My point is we wouldn't be doing this show here on Crossfire. You wouldn't be on television. Ben wouldn't be on television if it was all hepatitis B. It's because of the notoriety of AIDS that is stirring up this alarm. And so isn't that excessive? That's my point. When the risk, this other risk that no one's ever heard of, most of them, until they watch this show.
Well, if you call 1.5 million carriers of HIV notoriety, if you call 40 healthcare workers dead from AIDS notoriety, and if you call Kimberly Burgalis and 2 other patients in Florida notoriety, and if you call the CDC estimates of risk of between 13 and 128 patients with HIV
how many people have their teeth pulled in the course of a year in the United States?
Dentists carry out 1 billion procedures, including everything, a year. I don't know how many.
AIDS has been going on for 10 years, and there is 1 case known of 3 people dying.
Let me ask Mr.
Wrong. The fact is that CDC did estimates of risk on a retrospective basis and found that between 13 and 128 patients got AIDS from their healthcare workers.
Over the hundreds of millions of dental visits. It's one of the smallest risks in the world.
Mike, the public is in,
but it's lethal.
The public is interested in this, and it is lethal. People always die of AIDS. But let me ask Mr. Schatz a question. Now, we were lucky to find out in Kimberly Burgalis' case that she had AIDS, and it could be traced to her dentist because she had a very short incubation period of only 2 years. Now, normally the incubation period is 5 to 8 years, and so when somebody comes down with AIDS, they're tested, it's discovered, they can't go back to the doctor who may have given that patient AIDS in the first place because the doctor's dead. So, Mr. Schatz, what I'm getting at this, isn't it conceivable that there could be dozens, scores, hundreds of Americans with AIDS who got it from their doctors or dentists?
Well, I think, first of all, we have to distinguish between AIDS and HIV. But I certainly would agree that it's conceivable that there are other people who have been infected in this way. I'm not saying that there's no risk. We don't live in a world that has no risk. We live in a world of relative risk. And what I'm saying is the risk of restricting, throwing thousands of people out of their jobs that the public depends upon when there are a shortage of health workers, putting patients with HIV in the position that they are going to be denied care because doctors and dentists are going to be afraid to treat them. That is going to be a tremendous healthcare risk, and that is much greater. I agree there will undoubtedly be future cases that are going to happen in this way, but I think another point has to be made. I agree with Dr. Kubin that AIDS is expanding and not contracting, but we're not talking about the real issues here. There's been more media attention on these 3 cases of HIV than on the need for condom advertising on television, the need for prevention in minority communities. And that's where AIDS is expanding. That's the real issue.
The reason why we're even having this discussion tonight, and let me first say that these are my opinions and don't reflect any organization I belong to, but the point is we're having this discussion tonight because of Kimberly Burgalis having a short incubation period of 2 years while her dentist was alive. That meant that her dentist's blood and her blood was available for DNA sequencing by high-tech techniques never done before in the history of medicine.
Dr. Kubin.
Hold on, which for the first time drew the analogy and the conclusion that this was indeed a transmission from the healthcare worker to the patient.
Here's what the Centers for Disease Control say, and I'm going to tell you, and then you can tell me if it's wrong, because I'd really be interested to know. They say the risk works out this way. There's a 1 in 40 chance that your surgeon's going to cut himself in a major surgery.
That's correct.
There's a 1 in 3 chance that if he cuts himself, his blood's going to mix with yours.
That's also correct.
There's a less than 1 in 300 chance that you'll get HIV, even if the blood mingles, and even if he actually has HIV. And all that adds up to a chance of 1 in 15 million or less that you're actually going to go into the operating room and come out with AIDS.
Everything you said up to the last number is correct. And you ask Kimberly Burgalis or Mr. Driscoll or Barbara Webb whether or not their chances are 1 in millions. Their
Dr.
chances to
Kubin.
them were 100%. Hold on. And secondly, the point is this, that it's a cumulative risk. If the surgeon keeps on operating, and he's capable of transmitting this disease of low contagion, you're right, less than 0.5%, low contagion, but it's 100% if you get it. It's devastating, it's lethal, and it's final.
Okay, Mr. Schatz, we'll let you back in when we come back, and we're also going to talk when we come back